Hey Ravi, what are you doing?
Radhe Radhe. Today we are studying ulnar bone.
Anatomy of the ulna. The ulna is the medial bone of the forearm in the anatomical position. It is a long bone extending from the elbow joint to the wrist, lying on the little finger side. The ulna primarily forms the hinge joint of the elbow and plays a stabilizing role at the wrist. Parts of ulna. The ulna consists of three parts: proximal end, shaft, and distal end. A. Proximal end. Olecranon process, large hook-like projection forming the tip of the elbow, fits into the Olecranon fossa of the humerus during extension. Coronoid process, projects anteriorly, fits into the coronoid fossa of the humerus during flexion. Trochlear notch, curved surface between Olecranon and coronoid processes, articulates with the trochlea of the humerus. Radial notch, lateral concave surface for articulation with the head of radius. Ulnar tuberosity, rough area below the coronoid process for muscle attachment. B. Shaft, triangular in cross-section, has three borders, anterior, posterior, interosseous, and three surfaces, anterior, posterior, medial. The interosseous border provides attachment to the interosseous membrane. C. Distal end, head of ulna, articulates with the radius at the distal radio-ulnar joint. Styloid process, medial projection providing attachment to ligaments of the wrist. 2. Muscle attachments of ulna. Several important muscles of the arm and forearm are attached to the ulna. Muscles attached to the proximal ulna: triceps brachii, right pointing arrow Olecranon process, elbow extension. Brachialis right pointing arrow coronoid process and tuberosity, elbow flexion. Anconius right pointing arrow lateral Olecranon, muscles attached to the shaft. Flexor digitorum profundus, flexor carpi ulnaris, pronator quadratus, extensor carpi ulnaris, abductor pollicis longus, extensor pollicis longus, supinator. These muscles are responsible for flexion, extension, pronation, and supination of the forearm and hand movements. 3. Pathology of ulna. 1. Fractures: nightstick fracture, isolated fracture of the ulnar shaft. Monteggia fracture, fracture of ulna with dislocation of the head of radius. Olecranon fracture, common due to fall on elbow. 2. Dislocations. 3. Ulnar nerve injury.